I will explain the terms that will frequently appear in this lecture. The terms appearing here are not commonly accepted or well defined, rather, they are terms I've personally established for this lecture. Hence, it is crucial to precisely establish the meaning of each term from the outset to enhance your comprehension of the subsequent lectures. As indicated by the term example here, I have precisely defined, in a detailed encyclopedic manner, the settings for the various postural elements that must be met for each specific target area of every individual target tooth. This is the summary format you will continue to see in the upcoming lectures, and from now on, we will go over the definitions of the words and expressions used in this summary one by one. The tooth axis, as you well know, is an imaginary axial line that passes through 2 points connecting the root apex and the center of the incisal edge. The term alignment can be construed in 2 distinct ways within this context. To begin, regarding the tooth axis of the target tooth, if the operator's body is oriented in parallel, it will be designated as parallel alignment, whereas if it's oriented perpendicularly, it will be termed perpendicular alignment in this lecture. Perpendicular is again divided into perpendicular R alignment, depending on whether the operator is positioned to the right or left of the tooth, and will be noted as perpendicular R or perpendicular L alignment. Secondly, in cases where the operator's body direction is not strictly perpendicular or parallel to the target tooth's axis, we will still classify and denote it in the same manner if the operator's line of sight is either perpendicular or parallel. In this particular diagram, the red line represents parallel alignment, while the blue line illustrates the relationship of perpendicular alignment. While the previous slide discussed the microscopic alignment of individual teeth, let's now categorize alignment from a broader macroscopic viewpoint. This diagram displays the maxillary individual tooth axis. For explanation, let's assume tooth 22, an incisor. If the operator is positioned at the patient's 12 o'clock, the operator's body's orientation and the operator's line of sight will be parallel to the tooth axis of tooth number 22. Specifically, this red alignment is displayed on tooth number 22. From now on, I will refer to this alignment as the parallel alignment mode. Next, if the operator is situated at the patient's 8 o'clock position and turns their body towards the patient's head, both their body and line of sight will align perpendicularly to the tooth axis of number 22. I will designate that particular alignment as the perpendicular alignment mode. In this image, your body and your line of sight are aligned in the direction of the blue line. When the operator is at the 3 o'clock position and faces the patient's head, their body and line of sight are aligned perpendicular to the tooth axis of number 22. I will designate that as the perpendicular L alignment mode. In the photograph shown, this denotes the alignment of the operator's body and their line of sight with the blue line positioned on the right. This diagram shows each tooth axis in the patient's lower jaw. For explanation, let's assume we're using anterior tooth 42. If the operator's body is positioned at around 11 o'clock relative to the patient and oriented towards the patient's head, as indicated by the red arrow in the illustration, this means that the tooth axis of number 42, along with the operator's body and their line of sight, will all be in perfect alignment. I will refer to this specific configuration as parallel alignment. If the operator is positioned at approximately 8 o'clock relative to the patient and faces the target tooth, the operator's body and line of sight will align as shown by the left arrow in the diagram. I will define this as the perpendicular right alignment mode. Conversely, if the operator is at about 2 o'clock facing the target tooth, the operator's body and line of sight are aligned, as depicted by the blue arrow on the right side of the illustration. I will define this particular setup as the perpendicular left alignment mode. This concludes the definition of terms pertaining to alignment. Moving on, I've specifically used the term grasping to describe the action of holding the suction tube with the left hand. This refers to a postural element like in this photo. I've used the word hooking to describe placing the suction tube on the right or left corner of the patient's mouth without holding it. This refers to a postural element like the one in the photo on the right. We define the action of the operator bending their waist in a forward direction as waist flexion. The movement where the operator bends their waist laterally, either to the left or right side, is what is defined as waist bending. The act of an operator bending their neck forward is precisely what we define as neck flexion. Bending it to the left or right is defined as neck lateral flexion. The act of rotating either the patient's neck or the operator's own neck to the left or to the right side is formally defined as neck rotation within this context. We will refer to bending the tip of the suction tube inward in the direction towards the operator's body as bending inward. Conversely, bending the suction tip outward, away from the operator's body, will be termed bending outward. So far, I've summarized and gone over the terms that need to be reviewed before we begin this lecture. Our lecture, as shown on this sample slide, will display the operator's posture from various angles and the treatment view from their perspective in the upper portion. The lower part shows the alignment and category of the posture we are currently covering, which is the title. It also shows which target area of which tooth is being treated as a title. Beneath the title, it will detail how to position the chair, how to set the patient's head, and also where the operator themselves should be situated. It also provides detailed written explanations of how to position the operator's legs and feet. Within these textual explanations, I will be utilizing the specific terms that I defined and elaborated upon previously. Now, all the preliminary information you need to know before we begin the main lecture has been delivered. Finally, I'll present the seminar's overall table of contents. We'll start with the 20 series anterior teeth. In the category of parallel alignment while grasping the suction tube, we will examine how to set up each postural element to prep each target area, such as the incisal, buccal, palatal, mesial, and distal. In the same manner, when the suction tube is hooked in parallel alignment, we will be examining how each target region is approached by aligning from the right and then aligning from the left, making use of specific postural elements. After examining the various aspects of treating anterior teeth in the 20 series with this classification system, if time permits someday, I would also like to cover how to perform treatment without using an optrogate, as well as a standing posture for treatment instead of a sitting one. Following the same order and system, we will then cover the premolars and molars of the 20 series. Following that, we will be covering the 40 series of anterior teeth, premolars and molars. Following that, we will continue sequentially with the anterior teeth, premolars, and molars in the 10 series, and then move on to those in the 30 series. Now, I will first explain how to place the optrogate on a patient. Usually, the small size covers about 90% of Korean patients. Ensure that the portion of the optrogate resembling cat ears is oriented towards the bottom. You should apply pressure to the center of the optrogate so it forms a figure 8 configuration. With the patient's mouth wide open, instruct them to say "ah." Then begin by inserting the right corner into the corner of the patient's mouth. Next, the left corner is then inserted into position. Then ask the patient to bite down firmly. Then, you'll need to carefully insert the upper part of the optrogate deep into the superior vestibule. Next, you'll want to carefully fit the bottom section of the optrogate deep inside the lower vestibule. Given that it is quite difficult to properly insert the inner edges of the optrogate into both the upper and lower vestibules when the mouth is wide open, this procedure is performed with the patient's mouth gently closed. Let's watch it again. Once proficient, it can be done in 5 seconds. Let's examine the optimal posture when prepping the incisal portion of tooth number 22. Specifically for the maxilla, the chair's position is always adjusted and set to the supine mode. Maintain the chair's inclination parallel to the floor. In cases involving the maxillary arch, the patient's head position should always be maintained in a maximum reclined state. Tilt it back as far as possible like this. Recline the headrest all the way back and have the patient slowly move up the chair so that their chin is lifted upwards and the top of their head is lowered downwards, thereby positioning the head's angle appropriately. This helps the operator get a direct view of the maxillary tooth while maintaining good posture. From the patient's perspective, this chin-up posture might be uncomfortable. If they find it too challenging to recline their head, you can significantly lower the upper section of the dental chair, even beyond the supine position, to alleviate some of the burden on their neck and make it easier to tilt their head back. For head rotation, they should face directly forward, but with a slight angle to the right. Because we're dealing with tooth number 22, not 12, a slight turn of the head to the right ensures that the operator can secure a more optimal view, all while maintaining a healthy working posture. The doctor's position describes the location of the doctor's stool and hips in terms of clock direction relative to the patient's head, which is crucial for aligning the operator's body parallel to the tooth axis of tooth number 22. Position your body around the 12:30 mark. This is what the parallel category classification shown here means. There are distinct advantages and disadvantages to whether you align the operator's body parallel to the axis of the target tooth or position it nearly perpendicular to that axis. Depending on whether the target tooth is an anterior or posterior tooth in a quadrant, or if the target surface is buccal or palatal, there may be a more comfortable and suitable posture. I will explain this in more detail later. Body orientation is typically directed towards the patient's head. It's usually always oriented towards the head, but it can differ slightly when performing treatment while standing, or if the doctor's position is at 5 or 7 o'clock. This is something to keep in mind. It is advantageous for the operator to spread their legs comfortably wide so that the operator's torso is positioned as close as possible to the patient's head. In many cases, this close proximity of the torso to the patient's head greatly facilitates securing a direct view. Though not common, distancing your torso can sometimes enhance visibility. For your health, it is best to avoid bending, rotating, or twisting your back and neck as much as possible in any situation. To minimize twisting, bending, flexion, or rotation of your back and neck, it is essential to wisely set the patient's body and head position, as well as your own position and body orientation. This is because if the patient's body and head form the very foundation of the posture, and the practitioner's position along with body direction represent the tree trunk, then the practitioner's waist, neck, shoulders, and wrists are indeed the branches that extend outward from that main trunk. Proper setup from the roots is necessary for a good posture to naturally develop in the branches. Once you have correctly positioned the patient's torso, including their waist and neck, the next step is to properly adjust the posture of your arms, wrists, and fingers. Grasp the suction after lightly placing the 4th and 5th fingers of your left hand as a rest on the soft tissue of the masseter muscle. Place the suction tip in the space between the left retromolar pad and the tongue. With your right hand, place a rest on the premolar area of the number 10 section with your 4th finger and hold the burr. It's on number 22's incisor. The soft tissue on the outer aspect of the tooth is safeguarded by the opener gate, and the tongue is protected by the lingual hard tissue of the target tooth, number 22. The suction should be gently grasped and hooked onto the left corner of the patient's mouth. The light should always illuminate vertically downward, positioned directly above the patient's head. And now we'll watch a video showing the entire preparation procedure from start to finish. First, I emphasize assuming the posture corresponding to the main trunk and roots, then the posture for the branches. As you can see in the diagram, when treating the maxilla, the operator's neck angle is similar to the angle the patient's neck is tilted back on the headrest. So, when the patient leans their head back, the operator's neck experiences less strain. Considering that a patient is treated once, but the operator treats for a lifetime, I believe it's better to set the patient's neck as shown in the picture, even if it means prioritizing their comfort less. Instead, an alternative is to shorten the chair time and give the patient break times to sit up intermittently.